Thank you very much. Even though I have a formal presentation, I want y'all to feel comfortable to raise your hand in the middle of the presentation and stop me before we go any further if you have any specific questions, and I'll do my best to remember to repeat your question so that everybody else can hear it. Again, I'm Jonathan Kaplan. I've been in Baton Rouge since July of 2007 after my plastic surgery fellowship at the Cleveland Clinic, and I'm very happy to be here today. I'm going to tell you a little bit about the things that are available to you in plastic surgery. It doesn't all have to be about surgery. It can be about cosmetic medicine, the least invasive types of procedures. We'll just go from the least invasive, being like skincare, to injectables, to surgery, and talk about a little bit of everything, and we'll go from there, okay? Have a little surprise for you at the end as well. So the center where I work, the Center for Reconstructive and Cosmetic Surgery at Our Lady of the Lake, I'm the board certified plastic surgeon. We have another board certified plastic surgeon and craniofacial surgeon joining us in July. Business manager, RNFA, receptionist, esthetician, and so we kind of have all the services you need, and anything that you need, you get 25% off of procedures, off the surgeon's fee since you're here today, or 10% off any injectables since you're here today. Just so you know where we're located, we also have business cards and brochures up here at the front. We're located at Medical Plaza 1 behind the lake, Suite 708. And also on Thursday mornings, we now have an office over at Suite 250 over in the Physicians Tower at Women's Hospital. And I'll mention it again later, but we actually, since we just started that clinic location, we're providing a Botox for $8 per unit, which is probably the least expensive in town from a board certified plastic surgeon, which $8 per unit, so just kind of give you the whole picture, because some people come in and think it's going to be $8. It's not the way it works, and we're not trying to be deceitful. So this is my full disclosure. $8 per unit. A treatment is typically 10 to 50 units, so that means your price is going to be $80 to $400. That's the full disclosure. There's no hidden prices there. $80 to $400 depending on your treatment. Some people are nodding yes because they've had that problem before, I guess. Anyway, so the office we have over at the lake, though, we have a procedure room that we actually can perform fully like anesthetic cases with a board certified anesthesiologist under deep sedation and local. We can do facelifts that way. That's typically how I do my facelifts without putting a tube in the throat. It's better for the blood pressure monitoring the whole time, better for reducing hematomas afterwards. So I just want you to know that we do have an operating room in our office, and we can take care of you in there. We don't have to necessarily go to a surgery center. You have the same people you'll see, the same comfortable surroundings that you saw during your initial consultation. We also have a state-of-the-art private studio for before and after pictures. And the thing that's so important about this is that you see pictures of people like with weight loss, and then the first picture they have no makeup on and they look miserable. And the after picture, after the weight loss, you can't really tell if they have lost any weight, but they have makeup on now, their hair is done, they look great, they look happy, so you're not really sure what it is. So with this, with our photo studio, we have the same lighting, the same environment, so we can have really accurate before and after photos. Exam room and office esthetician, which I mentioned, electronic medical records for more accuracy, and we have a laser and IPL for multiple applications, which I'll go over in a second. So the issue is we're here for aging. The idea is that with the wrinkles, the increase in the wrinkles is due to loss of elasticity as you get older, thinning skin, sun damage, descent of the skin, so that the fat that was up in your upper cheek is now down in your jowl area, fat atrophy, and weakening of the ligaments in the face. Most people don't think of ligaments in the face, but they are there. They lengthen, they stretch, and that's kind of what a facelift does, is kind of repositioning those. Now, plastic surgery and cosmetic medicine can counteract all of these, but of course, as we all know, it's only temporary. So let's start with the least invasive, with cosmetic medicine. So with the injectables, we have Botox, Juvederm, Radiesse, topicals. The ones that we have in our office are RX Solutions, which patients, it's relatively new. Patients have been very happy with it. Vivite from Allergan, La Roche-Posay, and Latisse for lengthening of the eyelashes, which is the only FDA-approved medication for lengthening eyelashes. So let's start with Botox. Basically, you inject it into the muscles, helps to inactivate those muscles, and it's in areas where your skin has thinned out, so the wrinkles were more obvious. When you knock out those muscles, the skin stops wrinkling and thins out, and have a younger looking appearance. Botox has been an incredible product. It's because it works. That's the reason it's been so incredible. Lasts anywhere from 3 to 4 months, and there have been studies that show that it does last a little bit longer with subsequent treatments. Again, as I mentioned, $8 per unit at our women's clinic only. And there's our full disclosure of $80 to $400 for a full treatment. Just to give you examples of where you can, let's see, I guess no laser pointer, but anyway, so you can see the blue dots are kind of where we treat the areas, the glabella, which is the area in between the eyebrows, around the crow's feet, the forehead, and all those things. And what I try to do with the forehead is sometimes you'll have patients that have this frozen look. So that's kind of when you've done too much Botox. Then you also have patients whose brows or eyebrows are ptotic or have ptosis or are drooping. And that's because you've knocked out these muscles right above their eyebrows. So what I try to do when I'm doing Botox to the forehead, try and go on the upper part of the forehead so you get the area that they're concerned about. You don't treat the whole forehead. You don't treat the area right above their eyebrow so their eyebrows don't droop and have this kind of sad look. So there's a way to, as long as you go to somebody that's had the appropriate training, there's a ways to get something done, but everybody will look at you, think how good you look, but won't know exactly what you did. And that's the trick to plastic surgery, is doing something without everybody knowing about it. And just thinking overall you just look great, it's that you had a good workout that morning or something. Juvederm is another product that's made of hyaluronic acid. It's the same products that come from your knee joints, but it's a synthetic product. It's not from humans. And this is great for filling in these parentheses lines and also for filling in the lips. This lasts up to 1 year. You've heard of Restylane. It's the same product except there's more cross-linking with Juvederm. And what that means to you is that it lasts for 1 year, whereas Restylane lasts for 6 months. I don't offer Restylane in my office just for the reason that it's the exact same product as Juvederm, but why use something that only lasts 6 months when you can use something that lasts for a full year? So that's why we use Juvederm. Then Radiesse is a product that you can also use in the face and you can use under the eyes. People who have the hollowing out under their lid to cheek area, you can inject Radiesse there. And this is a calcium hydroxyapatite. We inject it right onto the bone. We get you nice and numb for those kinds of things. I typically like to do a dental block whenever we're doing injections around the face so that you don't have any pain. With the Radiesse, you can't use that on the lips, so the Juvederm still has a place for that. What I want to kind of take a little segue here and talk about Sculptura. Sculptura is a product that's been out for a few years now, and it's actually made from the suture that doctors use before they've been used in patients. The suture is called Vicryl, and they've turned the Vicryl suture into beads, and then that's what you inject into the face. It's called Sculptura, and this is a big difference from the fillers. The things I just talked about, ones that fill in specific lines. But if you have hollowing out of the cheeks and things like that, you don't really want a filler that just fills in a line. You need something that helps to volumize. So this is what I'm trying to clarify to you, is the distinction between fillers for lines and volumizers for kind of hollowed out areas. And Sculptura works great for that. And the downside about Sculptura, and I'm going to tell you all the bad things so that I can show you the great thing about it. Sculptura takes 3 treatments on day 1, then 30 days later, then 30 days after that. So you end up getting 3 treatments over the course of 2 months. Each treatment costs $800. That's a total of $2,400. That's a lot of money, I recognize it, but if you're hollowing out, but you don't have heavy jowls, you don't want to get a full facelift, you want no downtime, thanks so much. If you want no downtime, then you can do Sculptura. And let me show you a before and after picture of a patient with Sculptura. This patient here, let me just kind of point out, she's actually a very attractive woman. I'm not, hating on her or anything like that, but she has this hollowing out right here. She has these deep lines right here, and then she has hollowing out right here. All right, now a filler might be able to help with that a little bit, might be able to help with that, but this hollowing out here and to some extent here, and there's areas here under the lip, those things won't work as well with a filler. They work best with Sculptura. So after 3 treatments of Sculptura, after 2 months of treating her, and these results last up to 2 years, this is her result afterwards. You can see those deep folds that you saw before are no longer there. These are lighter. Her cheeks are fuller, and I know her hair has changed a little bit. I couldn't tell her to not change her hair, but obviously there's an improvement here. And yes, it's $2,400, but unfortunately, to play the game, you might have to pay a little bit. It's actually, my prices are really not, I know this may not sound true, but we're really not making a profit on this because it is so expensive. You can't really increase the cost of it too much to make a profit, because then you price yourself out of the market. But then people come in looking like this and then they speak highly of you. So $800 is pretty much the cost of it. Anyway, so I just wanted to talk to you about Sculptura in that respect. So fillers are great for lines, volumizers are great for hollowed out areas. In this particular case, I think you can see. Any questions about that? That's a great question, and yes, there are things. For example, fat is a great, I know we all think fat is not our friend, but fat can be our friend. And what we do a lot of, what I do a lot of is taking fat from the abdomen during liposuction, and then we centrifuge it down, purify the fat so we get rid of like the oil and things like that. And we take the fat and we can re-inject that into the face, and that's great for volumizing. I do fat injections on all my facelifts. In this particular patient, you could do that. Obviously, people want to come in and get something injected and be done and go home. They don't necessarily want to lay down and be sedated and get fat taken out. But if you were in the mood to do that, then we do fat injections. 50% of the fat is gone at 6 months, but what's left after that is there for good. So that's why we overcorrect with the fat. All right, so yes, there is a surgical procedure. She does not need a facelift. She just needs volume, and the fat would provide volume. And we're not trying to make her, a large rotund face, but there's an art to it. You just give just enough to get them restored back to their younger self, back from their 40s to their 30s. I would say 50s to the 30s, but she's 40, so I don't want to totally offend her. And of course, she gave me signed permission to use that picture. If you came in and didn't want your images seen, of course, that's not a problem. So 6 months, and so we overcorrect so that you still have a great result after that. So with Fitzpatrick skin types, it's just kind of how you judge your skin, whether you always burn, and depending on how much SPF, how much sunscreen you need to protect your skin. This is probably the most important thing. When you're young with your kids, start using sunscreen on them to keep them from having a lot of the problems I'm talking about today. So to help with those issues, though, let me get back to the presentation mode. So one of the products we use is La Roche-Posay. It has a few different things. It's the Active C is for antioxidants, which is kind of scavenges all those oxygen radicals that are bad for your skin, that kind of damage the DNA in your skin, so you can't repair your skin after getting sun damage. The Anthelios XX, it's got an SPF and a moisturizer in it. I use that, and I use that every day, and I know lots of guys that use that. I feel like I'm at an AA meeting. I'm admitting to my but this is a great product that I do use every day. And it's just a moisturizer. And people think that you don't need sunscreen unless you go to the beach. That's not true. Whenever you're out in the sun, even if the sun's not out, if it's just, if it's daylight, the UV rays are getting through, damaging your skin. So I highly recommend any kind of SPF in your makeup or in this product, for example. Melody is for improvement in pigmented areas. It's like a hydroquinone substitute. There's been some issues in Europe about hydroquinone containing mercury, so they're trying to find some hydroquinone or bleaching agent substitutes, and that's what that is. Vivite has a line also for Vibrance is their product that is their hydroquinone substitute. I can't go through all these things because obviously it's too many words, but I just wanted you to kind of know that there are some skin products out there that are very helpful. Latisse, which a lot of you have heard about, it works. That's all I can say. Is the reason it sells so well, the reason it's so popular is because it works. And that's how you know when something works, is when everybody's talking about it and they're showing you their results. All the ladies in my office use Latisse and their eyelashes look great. The interesting thing about Latisse is that it was initially a drug for glaucoma that you put in the eye. And there were some instances, and the men were coming in complaining their eyelashes were hitting their glasses, and then the company realized that they had a winner on their hands. Now the thing that you've always heard about, and I'll talk about it right here, is that the iris, if you have blue iris or beautiful blue eyes, at the risk of using this medication, can change your eye to brown permanently. And that is true when it was used as a glaucoma medication. They put the Latisse directly in your eye. It didn't happen to everybody, but there was a small % chance that if you had blue eyes, it could turn brown with using it as a glaucoma medication, putting it directly in your eye. The reason I'm going to such extent to explain that to you is that with Latisse, you only put it, you use these swabs right here to just to brush it onto the upper eyelid, just the lash line. You do not put it in your eye, you put it on the lash line. And then used in that fashion, it has not changed anybody's iris color since they've been using it as Latisse. As the glaucoma medication, yes, small %, but in Latisse, there's been no instance of that as long as you use it appropriately. So I know that was going to be somebody's question, so hopefully I've answered it adequately. So we've talked about the skincare, let's talk about the things, a little bit more invasive things. We've talked about injectables. And again, a lot of these things are used in conjunction. So this is what I call a no-scar blepharoplasty. Doesn't mean no incision, but there's no scar. And what we do in patients who have these fat bags right here, what we can do is, she doesn't really have excess skin. We go on the inside of the lower eyelid, go on the inside of it, and we can get this fat out. And then that takes away the fat bag here. Now she had some fine wrinkles here, which I'll show you how you can treat that in a couple slides. But the nice thing about this procedure is we make an incision on the inside of the eyelid. You don't even have to close it with stitches. It closes on its own, take out the fat, and the bruising, surprisingly, is very minimal. There's another patient who had the same issue. You can see how she had this large fat bag. We just went on the inside of the lower eyelid, and that's gone now. Yeah. It does. The thing that's interesting about black circles is a lot of people think that black circles under the eyes are because of capillaries and things. It's really not that. What it is that because you have this problem with the lid cheek, as your fat from your upper face descends, you have this hollowing out right here. And the dark circles are a lot of times actually just the way the light hits the lower eyelid. So if you restore the lower eyelid to where it should be, getting rid of the fat so that the light doesn't hit it in a funny way, or we use Radiesse to inject it in that area to help bring out the lower eyelid, that actually improves the dark circles just because of the way the light hits it. Believe it or not, it's actually kind of an optical illusion. It doesn't mean you can't use hydroquinone or a bleaching agent to help it also, but a lot of times it's just a optical illusion. Now in this patient, she had these fine wrinkles. I was alluding to that earlier. She has these fine wrinkles here, and we did a chemical peel. This isn't the chemical peel your esthetician does. This is called a phenol crotonol peel. It's much deeper. There's more. You have to be in your house or whatever for about a week to let the skin peel, be out of the sun. A lot of times people will get this while they're getting a facelift and things like that. But I'm going to kind of go off on chemical peels for a few minutes here because there is nothing in the world that works as well as a chemical peel and as permanently as this product. It's really amazing. You can hear about lasers. They don't work as well, plus they cost a lot more. But there's something about chemical peel that if you're willing to do the downtime, which is, like I said, you're in your house anywhere from 5 to 7 days afterwards, you're not like sick, your eyes aren't swollen shut, but it's just you don't want to be out in the sun while your skin's peeling. But if you can put up with that 5 to 7 days, it's going to give you a miraculous result. So for example, you can see this patient's got these fine lines. They're gone here. You can see fine lines there. They're gone there. Give you another example of a patient, and hopefully it's coming out in your images from where you are. But this patient's got these fine lines right here and right there, and it's all gone now. This is smooth as a baby's bottom now. Now, after the chemical peel is done, after it's done peeling after that 5 to 7 days, there is some residual redness, but that can be covered up with camouflage makeup. I send them to the manager at Sephora, Patty Grass, who meets with them and talks to them about the camouflage makeup and how to cover it up and how they can re-enter society after that 7 days. But if it's not coming out on your screen, you can look at my computer afterwards. We also have these pictures on the website. It's very, very clear. It's how smooth out that is. Give you another example, really dramatic example. These deep creases right here, all those deep creases, you can't get rid of that any other way than with a chemical. A facelift isn't going to get rid of that because the facelift lifts this area. It doesn't affect these lines right here. So you can see right here, I mean, the proof is in the picture here. It's all this area is complete, all those areas are completely gone. Obviously this patient's very happy. This is really good for the perioral wrinkles. This patient has more of these wrinkles over here, but if she had deeper wrinkles right here, this is what you want is a chemical peel. It will erase those wrinkles away. Rhinoplasty, it speaks for itself. Permanent lip implants, we're just kind of still talking about the least invasive, not the least, the middle invasive things. This patient, she didn't like her wrinkles or the wrinkles in her lips, so she got permanent lip implants. We make a small incision here and here that even after the procedure, we put a stitch in, you still can't see it because the lip is coming together enough. And you can see the results here. I mean, she's got a nice pucker to it. It doesn't look ridiculous. She also has this scar here, and this was just an added benefit. We weren't really planning on this. She has a scar here that as the lip rolled out, you really can't see that scar anymore. So permanent lip implants, if you don't want to keep doing Juvederm once a year for $500, the upper lip is $1,000, the lower lip is $1,000, a total of $2,000. But then after a few years of Juvederm, you would have spent that much anyway. Not saying lip implants for everybody, and I hope that I'm not so, I guess convinced on plastic surgery, but I don't think she looks ridiculous. I don't think she looks like she has fish lips, so tell me afterwards personally if you do think so. Anyway, so here this speaks for itself, a neck lift. We make an incision behind the ear. Some people think that with a facelift, if you want a neck lift that you have to get a facelift. That's not true. If you get a facelift, it does include a neck lift, but if you get a neck lift, you can just get a neck lift. The benefit of a neck lift is you make an incision behind the ear that nobody ever sees. You lift the neck, make a separate incision right here that nobody really, in this natural crease you already have right here, so nobody sees that, and can make this person who didn't have a facelift look tons of years younger. There's another example of a facelift. These are the befores, these are the afters. Shouldn't have to say that, but you can see her jowls here are not as pronounced. This kind of frowning appearance that she had is no longer there. Her neck, you can see the neck is a nice sharper looking neck. And she doesn't, we haven't manipulated her eyes as far as like, she doesn't look like she's going through a wind tunnel or anything. To me, it looks like a very natural result. And the thing that's interesting about facelift is that people associate the weird eye look with a facelift, which is interesting because that's not, in a facelift, you don't manipulate the eyes at all. That person that you're thinking of that has this really weird look, they must have had something done to their eyes at the same time as their facelift. But it's just very interesting, the kind of the fear people have of facelifts is really what somebody has done to their eyes, not to their face. Sure. Yeah, okay, so if you're with a facelift, a neck lift, liposuction of the face, liposuction of the neck, depending on what you're a candidate for, I put all those patients under a deep sedation, not a tube in the throat, that we do it in the office with a board-certified anesthesiologist. We numb up the area that we're going to operate on. We inject that, but you also get an IV in that sedates you, but you're breathing on your own the whole time. There's no tube in your throat. So if there is a sedation, no doubt to it. There is anesthesia involved, but not the kind where you're hooked up to all these monitors and the machine's breathing for you. Yes, ma'am. I'll get to that at the end because I have an app that's going to be able to give you all that pricing information. All right, so I want to talk about breasts now. Depending, the patients come in after they've had kids, they want a tummy tuck, they want their breasts lifted. The thing with breasts is that if you have this amount of ptosis, a little sag to the breast, you can put implants in, but the problem is you can just put implants in alone, but what will happen is you'll have these implants and then you'll have the breast tissue still sliding off the front. So in that case, that's when you have to take out excess skin. And I know people don't like these scars, but the important thing, and those are stretch marks, so there's not a whole lot I can do about that. But these vertical scars that people don't like, there's really it's kind of a necessary evil because the only way you're going to be able to get the breast lifted and projecting. The projection is from the implant. The lift is from taking out excess skin and lifting them. If you don't do the lift, then will have a very unattractive contour. Whereas this patient, if you can ignore the scar, she has a nice round contour, very nice looking breast with the scar. If you have less ptosis or less droop than this, then you're a candidate for just a periareolar or a scar just around the areola with no vertical scar. So this patient has less droop than the other one. So what we do is we actually take out the excess skin around the areola, and that tightens up the skin envelope. And so you can see in this particular patient, her only scars are around her areola. She's got a nice contour to her breast, no vertical scar. But it's not just because I like this patient, I didn't like the other. You can only work with what you're given, and this patient had less ptosis, less droop to her breast, so we're able to do this no vertical scar breast lift and augmentation. And also, I want to make it very clear that if you want to lift, you don't have to have implants. If you already have a lot of breast tissue and it's just drooping, then we can take out the excess skin, lift the breast. You don't have to have implants if you don't want them. I'm not here to push implants on anybody. This particular patient just wanted more projection, so we did do implants on her. So with the tummy tuck, a lot of people think that tummy tuck is just to take out excess skin. Well, in this particular patient, obviously she didn't have excess skin, but she had 5 kids, and she had this bulge right here. And a tummy tuck really does all of those things. The tummy tuck, we do liposuction at the same time to help contour out the flank areas. We take out the excess skin, of course, but then we also tighten up the six-pack. And that's what helped with this particular patient. You can see the flattening. These are because I put stitches to bring the muscles closer together, and that's why she has a nice flat tummy. Now, this is a patient who did have excess skin, and, well, you can see, yes, I know there's a long scar there, but, again, there's really no way around those kinds of things. The thing I want to point out, though, is the scar, is I have patients come in their bikini bottom or their underwear. We mark where that is, so we make sure that the scar is underneath that. So, yes, there's a scar, but nobody else is going to see it except her and her husband. And obviously, I would think you'd have to admit that the benefit here outweighs the risk of the scar. And of course, there's liposuction, which is this is a great technique to have. You'll hear about a lot about laser lipo. I perform tumescent lipo. Laser lipo, unfortunately, there's nothing wrong with the machine, but unfortunately, it's often done by non-plastic surgeons, people who did weekend courses. And you got to be really careful. They may say they're board certified, but make sure they're board certified in plastic surgery or dermatology. I've seen a lot of complications from a board certified orthopedic surgeon that's doing laser lipo. I can't think of anything more immoral than a doctor who patient's trust, taking advantage of their trust and doing something they shouldn't be doing that they're not trained on. But tumescent lipo is a 2-step process. Laser lipo is a 3-step process. Laser lipo tends to be more expensive and unfortunately often done by non-trained or non-plastic surgeons or non-dermatologists. But anyway, the tumescent lipo we do in the office, and obviously you can help take, I mean, this person's working out a lot, but they'll never get rid of this fat here, and so obviously you can actually see more in this area right here and around the side. So that's all with tumescent lipo, not laser lipo. So now the question everybody's wondering about all these procedures I've shown you is, the most obvious question is, how much does it cost? You already asked, how much does it cost? So what I've developed, and actually it was just released on February 1st, if you have an iPhone, you're in good, this is good luck for you. If you are an AT&T, you already have an iPhone. On February 10th, 5 days from now, Verizon will have the iPhone and you can get it. But now, so how much does it cost? Now there's an app for that. And I developed this app. It's not just for me, it's for all plastic surgeons who want to be a part of the app. And if you have your phone with you, you can go to the iPhone App Store, go to the store, get into the search mode, type in Build My Bod, one word, no spaces, enter your zip code, and because most of you probably live around here, the first doctor that will come up will be me. But there are other doctors in the area that you can take a look at as well. And the thing that's nice about this app is it doesn't just give you the doctor's fee, because a lot of times you have to do these things under some anesthesia, and so you have to include those fees also. And if you're doing something with implants, those are implants as well. Because think about how many times some of you have called the doctor's office and asked the person at the front desk, how much does something cost? And they can't really tell you. It's not because they're being evasive or they want to keep it a secret. It's because the person at the front desk doesn't know how long it takes how long their plastic surgeon takes to do certain things, and so they don't know how to add up all those costs. Well, this adds up all the costs, the OR time, implants, garments, all those things, and gives you and sends you an email of that estimate, that itemized estimate. This has never been available before, and now you have it at your fingertips. Now, if you want more information, go to buildmybod.com. You also go to Facebook to learn more about it. You can download it, of those things. And if you don't have an iPhone and you want to come up afterwards, and I'll type it into my phone and I'll tell you what the price is. Since I can't really remember all those prices all at right off the top of my head. No, the thing is with the app provides different functionality than a website. Think about a website, you can't scroll up and down the body and tap on different things because it's a computer screen, you can't really tap on it. So that's why the app is more conducive to doing this than a website. Yes, ma'am. Yes, ma'am, exactly. Yeah, if you're on your iPhone, you can get it all off the app, exactly. And that's any questions? That's all I have for you today. Yes, ma'am. It's a solid silicone. We actually have samples at the office that you can come and play with. They're not like you know, silicone implants. They have like a silicone shell and they have liquid on the inside or a gel on the inside. The lip implant is a solid that you can actually bend and squeeze and all. There's not a separate shell and a liquid inside. It's a solid silicone implant that's very stretchable and distensible. So it's I guess homogeneous is the word I'm looking for. Any other questions? Yes, ma'am.
I think it's the liposuction where you sat on that, like on the side.
Sure.
Where is the scarring?
Right. Usually, well, the thing with liposuction, the cannulas are only about 3 to 5 millimeters long, very, very small, smaller than an inch. And you can put them in the groin creases, which are just hidden very easily. It's interesting how people are very concerned about the scars associated with liposuction, but those are the best, smallest scars that there are. Which is the whole idea with liposuction, is it's a less invasive, I mean, I put it in quotation, less invasive because you're still sticking a cannula in somebody's body, but it's less invasive way of treating somebody without a long scar. Yes, ma'am.
Did you say like with the breast lift, if you had dense breast tissue that it might not be necessary to get?
That's absolutely correct. Yes, ma'am. And that's something that, yeah, I kind of assessed at the time. The best way I can describe it is if somebody comes in with breast droop or ptosis, and their breasts are kind of flat up against their chest, their body, they're very flat, then those types of people may need implants to give them more projection. Again, you don't have to have implants no matter what, but a lot of times patients come in with the idea that they're going to have their breasts lifted and have projection, and you can't really always do that without implants. So if they have a very flat breast up against their chest that's drooping down, you can lift that without implants, but they're going to be very flat still, but at least the nipple will be in the right position. And then if you don't talk to them about implants ahead of time, then they might be disappointed when they wake up. But no, if you have a lot of breast tissue and you can just feel if there's a lot of breast tissue and you're not flat up against your chest wall. Then you take out the excess skin, and then you basically have a nice breast lift with projection because of your own breast tissue. Yes, ma'am. No. Reduction is a nice technique because that reduces the breast tissue and it lifts you at the same time. Set up on payment? Yes, sir. There's a couple different things you can do. You can pay payments, and then have after it's paid in full, you can have your operation. The other option is to go with care credit, and care credit will pay the doctor the full price of the procedure, and then you just pay payments to care credit. So one option is you pay everything up front, then get the operation. The other one is you get the operation, then you make all the payments to care credit. And there's different options. They can do 6 months, no interest. I mean, sounds like a car, but anyway, 6 months no interest or over 18 months. And of course, the longer you pay it out, the more expensive it ultimately will be. Great questions. Anybody have any others? Yes, you can actually. As I was mentioning, that I take fat out during a facelift out of the abdomen. I'll inject fat into the under the eyes and things like that. And if you take enough fat, you can inject it into the breast. For patients who've had breast reconstruction after cancer, maybe they have little contour deformities and things like that, I do take their fat from their abdomen or thighs and inject it into their breast. If you want a pure augmentation, like you don't want, like you're coming in for a cosmetic augmentation, you don't want breast implants, but you just want your breast filled up with fat, then yes, I'd do that. But I would also recommend you to Cameron Kubehi in Metairie, who actually is the world leader in that, and he's and he does some incredible work where he basically can augment patients' breast with just fat alone. It's more expensive because it takes more time, but you absolutely can do that. I know that my breast augmentations for saline are $4,000 total. Silicone implants augmentation is $4,500. So his fat, again, he is actually on the app, so you can find out how much it is, but I know it's substantially more expensive than that. But we'll look at it on the app when you come up afterwards, all right? Yes, ma'am. Yes, ma'am. Do a lot. No. It all depends on some patients who have like a nice neck. Then we can just do a mini facelift where we just lift up and are treating their jowls. Mini facelift is really for people who have jowls but not a really sagging neck. So if you do a mini facelift, you can definitely do that. You don't have to have previous work or anything like that. And the mini facelift, the incision's isolated to the front of the ear. And then if you do want to do something with the neck, then you go behind the ear. Yes, ma'am.
Which one of these procedures is similar, I guess, to the lifestyle lift that you see on TV?
Right. Yeah, the interesting thing about the lifestyle lift is it's actually not a technique. What it is, it's more of a marketing campaign, and I'll try and make this as succinct as possible. That there's a company, Lifestyle Lift, that sets up I guess practices all over the country, and then plastic surgeons who have time or from their practice, if they're just getting started, 1 or 2 days a week they come to do operations on these patients that the Lifestyle Lift people kind of set up for them. So your initial consultation is actually with a business person or an office manager, not a plastic surgeon. And so what they do is they'll set up as many patients as they can in one day, and they let the plastic surgeon or dermatologist or whoever they are do whatever technique they can do to get in and out of there as quickly as possible. So if you have 3 or 4 patients, I mean, a good facelift takes me 3 hours. So if you have 5 patients, then the person's going to do like maybe a skin lift or something like that. It's not a specific technique. I want to be very clear. The lifestyle lift or the feather lift, it's not a technique, it's a marketing campaign so that you don't actually see your doctor until the day of the operation. So you have a consultation with a business person, and when you show up, the doctor's going to do whatever technique they can do the fastest because they've got a lot of patients to do that day.
So you have no idea how qualified or board certified?
Correct. They may not even be a plastic surgeon.
I call them once. They call me all the time.
Right.
You know, and I just decided no.
Right. It's a centralized office, and what they'll do is they'll show you the cost of like the bare minimum, and then they show you a little bit. If you do this, it's a little bit more. If you do this, it's a little bit more. So it's a total marketing. So yeah, that's the kind of thing that I was even surprised about. As a plastic surgeon, you'd think I would know about all these things. I went to a meeting, not about the lifestyle lift. I went to a plastic surgery cosmetic meeting, and one of the topics was, what is the lifestyle lift? And it's not a technique, it's a marketing campaign. And whatever technique you get is just whatever is the quickest that the doctor can get you in and out that day. Yeah, buyer beware. Yes, ma'am.
When Latisse first was noted to the neighbors, it seems there was another side of it, but the virus.
Well, honestly, one of the, in the glaucoma medication that they talked about, the other side effect was making the lashes grow longer, which obviously is a good side effect for some people. The iris changing color, and I've seen like drying out of the eyes. I've heard people talk about that, but you can treat that, you know, with, you can treat that with like, you know, eye drops and things like that. Oh, the Latisse, I do know that off the top of my head. It's easy. It's one box is $100, and that's for a 2-month supply. So we end up selling it 2 boxes for a 2-month supply for both eyes. So $200 for a 2-month supply for 2 months. I mean, two eyes, 2 months. Thanks. Yeah, $200. And after we've seen you, and actually the interesting thing about Latisse, you also have to be careful about that because Latisse is a true prescription drug, and you have to have a dispensing license as a doctor to sell it out of your office. So not all doctors, I think, have dispensing licenses, not because they're trying to be dishonest, but because they don't know that if you're selling this product, you have to have a license. So I have a license, a dispensing license, and since it's a prescription, that the first time I see you, we, you know, it's a free consultation. We sell the product to you. But now that I've seen you, then we can just mail it to you after that. So 2 months later, you need more, we'll mail it to you. If I've never seen you before, we can't mail it to you. So just like a kind of a prescription where you can call in refills. It comes, you take it's a dropper that you drop on the swab, and then you just slide it across the lash line of your upper lid. And that's it. You do it before you go to bed. And the results start to show up at about 4 weeks, and then at 16 weeks, it's in full effect. And then just like Botox or anything, you kind of have to keep doing it. No, you don't. No, you don't have to. About 4 weeks, you're starting to see results, and then after that, it just gets better and better. Yes, ma'am. It has been working on your eyebrow? I'm glad to know that it works well, because I've had other patients tell me it works on their eyebrow, and so that's good to know, have more than one person saying it does work. And the interesting thing you can do is if you look, when you close your eyes, or close one eye at least so you can see it, you'll have some natural creases on your lower eyelid, and you can use that as your benchmark. So like when you start using Latisse, notice where the lash line goes down to on that lower crease of your lower eyelid, and then after about 4 weeks, you'll see that that lash has gone past that natural crease in your lower eyelid. Does that make sense? Basically, instead of just saying it looks longer, you can say, oh my God, it's like 3 to 4 millimeters below that line that it used to be before. Yes. Okay. Oh, by the way, men were trying to use Latisse on their scalps, and it wasn't working. It does not work there. Nobody knows why though. Right. Yes. Okay. Great question. Great question. That's called a chemical brow lift, and what we do there is, so if you think about the anatomy of the face, and sorry, a little anatomy review so you understand what I'm talking about, that you have muscles that are pulling up your eyebrow and muscles that are pulling down your eyebrow in the natural state. So they're always kind of working against each other. So if you do Botox too much above the eyebrow, then that muscle below the eyebrow will be unopposed and pull the eyebrow down. That's why you get the ptosis. The other thing you can do though is inject Botox just a very small amount right below the eyebrow, so then that makes this muscle pull up unopposed. And so that gives you a nice arch brow lift with Botox below the eyebrow. So I know it seems a little bit confusing and all, but if you do Botox just below the eyebrow, then it'll lift up the eyebrow for you, and you get a chemical brow lift. It's very nice, works very well. The other thing that's kind of nice is these muscles sometimes that right here, the depressor muscles, can pull down the corners of your mouth, make you look sad all the time. We can inject Botox here and here, and it'll knock out these muscles so that your corners of your mouth will raise up and you'll look happier. People who have that kind of golf ball appearance of their chin right here, that's the mentalis muscle. You can inject Botox there, and that'll take that kind of appearance away too. Everybody's looking to see if they have that now. These are great questions. Actually, I've been doing lectures for about 3.5 years now to these kinds of groups, and these are the best questions I've ever had. Yes, ma'am. Yeah, no, no, it's a great question. We were talking about the Fitzpatrick skin types depending on how light your skin is, how dark your skin is. Depending on how dark your skin is, that you would definitely not use a phenylcroton oil peel, but more like a TCA peel. That's a less heavy, less deep peel, less invasive. And a TCA peel I've done on African American skin, not Fitzpatrick type 6, but maybe Fitzpatrick type 3 or 4. You can do a TCA peel, which is lighter than a phenylcrotonyl peel around the eyes, and I've really had that improve their dark circles in that particular case. So would I do it around their mouth? No, it's probably pretty dangerous to do that, because then you have the risk of hypopigmentation, where it's much, much lighter, and obviously that's not a good thing. What I would recommend to start out with African American skin is hydroquinone. It's a bleaching cream, which is reversible. So you start using that twice a day, and if that helps lighten up the things that you're worried about, like dark circles and things like that, then that's great, then keep using that. But as far as a chemical peel, that's pretty dangerous to do, potentially. No, are you asking just out of curiosity, or you've read something before? Okay, the reason it's interesting. So there's a higher density of melanocytes, the cells that produce pigment in your skin. There's a higher density from your jawline up. So if you knock out some of those pigmented cells with a chemical peel, there's enough other ones out there that'll keep you looking normal. Below the jawline, over in the neck area, there's actually a much lower density of melanocytes. So anybody that knows anything, I mean, plastic surgery-wise, dermatology-wise, never does a chemical peel or a laser below the jawline on the neck, because there's so few melanocytes that if you knock those out, then the person's going to look like the movie Face Off, where they have a face that looks like it's not connected to that's attached to their neck. So no, I don't do chemical peels below the jawline for that reason, but you can use an IPL, which we have in the office, that does help. If you have any kind of like sunspots on your chest or your neck, you can definitely use it on that. The IPL is a little, it's less invasive. It's not as a chemical peel, so that's why it works well and doesn't cause these disfiguring looking, appearance. No. Actually, the truth is it's really red and inflamed, but after it's all healed up, if you do a chemical peel on the face, it's red for about 3 months, which I had mentioned you can cover that up with a camouflage makeup, and then it returns to its normal color. If you do it to the neck area, then it would go from that reddish color to a white color. And we pre-treat anybody we do a chemical peel on. We pre-treat them with retin A to help improve the quality of the skin, hydroquinone to kind of minimize any scarring or dark pigmentation, I should say, and then we also give them acyclovir, even if they've not had a fever blister or a cold sore or whatever word they use, whether they've had a fever blister or not. We still start them on acyclovir a couple days before the procedure and 5 days after the procedure to avoid them having an outbreak with a chemical peel. So it's a serious thing, but at the end, I think as you see from the pictures and from the website, it ends up being worth it in the end. And just so you know, we show patients the pictures the day after the peel and the next day after the peel before the operation to kind of give them complete, informed consent that this is how awful it looks the day after, the next day. But look at what this patient looks like 1 month after, 2 months after, 3 months after, and we even give them a patient's phone number who's agreed to be kind of a mentor. They call that patient to talk to them, to allay any concerns, have that person saying, yes, it really works great, you'll be all right. So it takes a lot of patient education, but in the end, it's worth it to them and to me.
It's full transparency, right?
Exactly right, full transparency. Yeah, who else shows you awful results the day after? But you have to, so that they don't come back and say, how come you didn't show me this?
Exactly.
Yes, ma'am.
Is there an age limit to the
It's a great question. Age alone is not a determinant of whether I'll do something or not. I've done operations, I've done facelifts on 76-year-old women before, but they had no medical problems. That's the trick. If they're on Coumadin and Plavix, they can be 40 and I wouldn't do it. So no, age itself is not a problem. It's what all their medical comorbidities are, and you come in for a free consultation and we can talk about that. But I have had a patient that came in, this is not something I show pictures of because it's not really applicable to that many people, but if you come in and you're 85 years old and maybe you have like one medical problem, I'm not going to do a facelift on you, but say your biggest complaint is that you don't like how deep these grooves are. And I think it's going to be too much to fill in with Juvederm. Like it would take like 4 or 5 syringes of Juvederm. What you can actually do is cut out the nasolabial grooves here and take out that deep groove that's there, and it will be replaced with a scar, But the thing is, the scar is in your natural nasolabial groove, so it's actually camouflaged really well because it's natural to have a scar there. So there are certain tricks you can do for certain patients that you would definitely not do with everybody, and you can do that. Yes, ma'am. Juvederm, yes, ma'am. I do. That's what I was what I was alluding to earlier is that a dental block, like a dentist, I go on the inside of the mouth and I numb up this nerve and that nerve on the inside of the mouth. It sounds painful, but I'm shocked, since I've never had it done to me, but I'm shocked at how little that hurts patients. I mean, maybe there's somebody out there that had a bad experience, but...
Well, I had it done, but they put the shot on the
Right, right. It's more painful there. There seems... Okay, well, that's, I'm glad in your case it didn't hurt, but in what I do is I go in on the inside of the mouth and numb up this nerve and that nerve. That numbs up the whole mid face. Numb up that nerve, and that numbs up the whole lower part of the face. And then you can do injections into the lip, and they don't feel it. They just don't feel it. It's not that it doesn't hurt, they just don't feel it. And you can do injections here. Plus now you can mix lidocaine with the Juvederm or mix lidocaine with the Radiesse, and that helps it also not hurt. No, collagen is, I don't want to say it's off the market, but the problem with collagen is that if you were using the ones that lasted longer, then you had to have a skin test first because it was from a cow or something, and so you'd have to have a skin test, and then you'd have to wait to see if you had a reaction to that test for a whole month. Then you come back after a month. If you didn't have a reaction, then you could do the collagen. It would last about a year, but patients don't want to come in and have a skin test and then come back a month later, so it hadn't sold very well. The other one that they did have on the market that you didn't have to have a skin test for was made from pigs, and that one that one worked fine. That was called Evolence, and it really did work fine. It lasted for about a year. It was a collagen from a pig that you didn't have a skin test for, but the Johnson & Johnson didn't feel like sales were adequate, so they've taken it off the market, not because of anything bad about it, just other than money. But there are different collagens that have been out there in the past. The funny thing about the collagen from the pig that doesn't require a skin test, it was made in Israel, which is kind of funny. Jewish people don't eat pigs. But anyway. So,
Well, what about the downtime after when you have the Juvederm or the neck and all that? Is there a lot of pain after?
Right. No, the Juvederm, I haven't had patients call me back with pain about that. There's no downtime with that. You might have some bruising, but there's no downtime with injections. As far as a neck lift, I have personally done neck lifts only on patients on a Friday, and they're back doing whatever they want to do by Monday. Facelift may be a different story, a little bit longer. And every person's different. Problem. Thank y'all very much. Oh yeah, thanks for clarifying. The app is free. And if you want to know about price, you can come up and I'll go through them with you.